Okay, everybody, thank you for coming today. This is going to be a life-changing half-hour health. So what we're going to talk about today is exactly what's on your notes. So what's truly causing heart disease? You know what's really amazing today? Do you know that the number one killer in our society is heart disease? In the early 1980s, the number one killer was heart disease. We've been on the low-fat, no-fat diet for 30 years, and people are still dying of heart challenges. We're fatter now than ever. There was just some articles that were released that sugar-free items can make people 6 to 7% heavier. Trans fat will make people 6 to 7% heavier. So what I want to discuss with you a little bit before we get started is the anatomy of the heart. And what I want you to see is that the heart is made up of 4 chambers. I'm not saying it to be silly, but the heart is a muscle. It's a pump. And what I've learned from my experience that this heart muscle is a very sensitive, it needs nutrients really bad. And one of the most common nutrients that is deficient in us as human beings is B vitamins. We use a whole food B vitamin in our practice. So what I want you to get is that there's little valves that separate these chambers here. Valves really don't change consistency because they're made of cartilage, collagen. But what changes in a person is the heart muscle. That's why we use whole food B vitamins, Cataplex B. Just as a side note, blood comes into the heart through this atrium right here. It's called the right atrium. And then it goes down into the ventricle. It pumps to the lungs. It comes back to the heart, and it goes out a ventricle. The heart is a pump. It's a muscle. But as patients that come into our office, I want you to also realize that your spine is like a set of breakers. So you have vertebrae in your spine, and these vertebrae can go out of alignment and put pressure on a nerve. Now, what I've been blessed to learn, this is going to be news to some of you, that what you eat can cause subluxation. And if you have a subluxation in your upper back on the left side, that goes to the heart. What I've found from my experience is there's a condition, what we call a visceral somatic subluxation, that when you eat sugar, sugar can refer pain and problems back up to the same vertebra that go to your heart. And I can see that on an x-ray. So what I want you to understand is that if you have a misalignment to the vertebra in your upper back and it goes to your heart won't work. So when you come into our practice and I give you a spinal correction, what's going on is your body has to function better. So I've been practicing for over 30 years. We don't have hardly anybody that ever dies of a heart attack. And I've had patients who've been a long, long time. Do you know why? Because we adjust their upper back on the left-hand side. Richard, that's why I gave you that adjustment the other day, to help your upper back. So how your body works, your heart is not a mystery organ, it's a muscle. Let's talk about the next item on the list, vitamin E. I have many patients that come into our office and they'll take synthetic vitamin E. We have learned through experience over time that most vitamin E from America comes from 1 or 2 labs. We don't encourage petrochemical vitamin E because it's not a whole food. Actually, I've done enough research to find out that some synthetic vitamin E's can actually raise your blood pressure. The vitamin E that we use in our practice actually comes from plants. It's a whole food vitamin E. We don't even encourage, if you notice, I don't encourage a lot of vitamin E. How often do I tell you to use? We use actually a product called Cataplex E. I'd rather have you eat fresh items, fresh food, fresh whole grains. Great source of vitamin E. So, what about the blood flow to the heart? Why do the blood vessels get plugged? And then we're going to go to the next one. What is LDL and HDL? And can you have a heart attack with Lipitor? The 2 of those work interchangeably. And here's what's so significant about when people have heart problems today. Recently it was just suggested that companies that make Lipitor, Mevacor, and Crestor, and Zocor, those are cholesterol-lowering drugs, they are saying that when you're on these medications, you can still have a heart attack. See, people die of heart attacks with normal or low cholesterol. Do you all understand that? So that means they're missing the boat. Now, this is something that I just want to pass on to you, that it was just one of those items that I've learned, that I don't think that medicine totally understands it, but it's important for you. When they give you a drug to lower your cholesterol in your body is like a fireman. That's the whole purpose of the fire hat. Don't you just love it?
Yeah.
Oh. I love this. And so LDL cholesterol is the fireman going to the fire. That's important. When they give you a cholesterol-lowering drug, like Lipitor or Mevacor, what that does is it takes the firemen out of your body. Nobody ever talks about that. So that's why these people can die when they are taking Lipitor, Mevacor, and Zocor of a heart attack, because your body has taken the firemen out of the body. Does that make sense to you? Those drugs have taken it artificially. See, the thing is, the firemen are going to a fire. The fire happens to be in your blood vessels. So nobody ever asked this question right here. What causes the fire? It's sugar. It's sugar. It's Crisco. It's trans fat. It's French fries. So everybody has been staying away from red meat, which I'm not telling you to eat red meat with reckless abandonment, but what I am saying to you is this. Stay away from the donuts and the sugar and the frosted cereals and yogurt, which has more sugar in it, by the way, than ice cream does. Yogurt has more sugar than ice cream. So that causes inflammation. Don't you just love this little fire hose? So by you taking Lipitor or Mevacor, now this is important, you're not getting to the cause of the problem. So what are you saying, Dr. Bob? You want to get adjusted. You want to stay away from sugar. Sugar is the culprit. You want to stay away from trans fat. You want to stay away from partially hydrogenated oils. You want to keep the fire away. Now, I'm going to tell you something that's really, really important and significant, and it doesn't cost next to anything. This is an apple. You can lower your cholesterol 13% just by eating an apple. I encourage our patients to eat at least a half an apple every day. You can lower your cholesterol. Here I just said 13% with an apple. You can lower your cholesterol, this is a big one, 40% by eating beet fiber. 40%. Now, do you think the company that sold Lipitor, which made $12.7 billion last year, wants you to know that if you take a beet, you can lower your cholesterol 40%? No. So I need to get you in your mind, you want to minimize inflammation. So cholesterol is not the problem. Cholesterol is a part of what's happening at the site of injury, because cholesterol is the fireman trying to put the fire out. Which takes me to the next item, is taking an aspirin healthy. In my opinion, physiologically, taking an aspirin a day is not healthy. Why? Because when you take an aspirin every day, what you're doing is you're tricking your body. So you don't want to trick your body. Your body works because, this is an awesome model, you're going to love this prop. This is a heart, obviously. And there's a power cord coming to this. So when I put pressure on this heart, do you see how it changes the movement of the electricity? So what I have found, if you don't have enough B vitamins, it alters electricity in the body. I also know that if you have a subluxation in your upper back, which I showed you at the beginning of the program, that affects the nerves going to your heart. So your body works by electrical energy. Your body needs to have the right nutrients for your body to send those messages down. So that's really, really important for you to get that. So we have to get rid of the inflammation in the body. And not to beat the dead horse, you have to eliminate sugar. People crave sugar. They have passion for sugar. They usually need more minerals. We use a product in our office called Cataplex GTF. GTF stands for glucose tolerance factor. Now I'm going to share a little item with you that very few people know. The real killer when it comes to the heart is a gland in your body called the adrenal gland. See, the adrenal gland is your stress gland. When you're under stress, your adrenal gland secretes something called cortisol. Cortisol helps your body function so you can get ready to move on. It changes the way the blood flows inside your body. But if you take cortisone too much, what can happen to you? It can weaken muscle. I just had a patient that came in this morning that's taking prednisone. If he gets on prednisone too low, he starts getting headaches. He's losing muscle tone. So if any of you are taking any kind of cortisone, prednisone, any type of drug to help your adrenal gland, over time, you could have more challenges, okay? How do you know if your adrenal gland is weak? Well, bright light will normally bother your eyes. You'll get dizzy from a sit to a stand position. Those are signs to me that your adrenal gland is weak. We really encourage using Celtic sea salt in our practice.